nutrition, 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 nutrition.
Good morning, and thank you to NAFSAN for having me here. So in this presentation, I'll start by giving a brief introduction of who I am, and I'll go on to tell you a little bit about what WHO does, why nutrition is critical to the work of the World Health Organization, some perspectives of nutrition from the World Health Organization, and we would have some reflections on the situation in Namibia. I'm not going to go into too much detail on the situation in Namibia because I believe other speakers will do that. So before I delve into my presentation, I would like to start by an introduction. So my name is Mary Nanama Brantuo, and for those of you who may know some other countries, you may recognize some of the names as coming from another country. So I am a medical officer, and I did my medical training some 2.5 decades ago. So after my medical training, I was assigned to the pediatric department for my internship. So I started my internship in that department. And one of the observations I made during that internship was the fact that we had several children, a lot of children coming in with anemia and other forms of malnutrition which were preventable. And I particularly recall one gentleman who came in with a toddler who was about 2 to 3 years old. And he came in during the malaria season in the country where I come from. And during the malaria season, children with anemia are particularly at risk. So we did all that we could for that little boy. And the little boy died in his father's arms. And as the little boy died in his father's arms, it was a very traumatic event. The father was calling. The little boy was called Fifi. Oh, Fifi, Fifi, Fifi. And we were running around, and that little boy died in his father's arms. That actually made me start thinking a lot, because there were a lot of children coming in that way. So I was wondering, in my work going forward, should I focus on the hospital? They are doing a good work, but there are also children out there who are dying from preventable illnesses, who are getting sick from preventable illnesses. And for that reason, my path in public health. And it's this path in public health which has led me to where I am today. So I would now go over to what WHO does. So WHO, the World Health Organization, is part of the United Nations, and it is the leading organization responsible for health, international health or global health. And within the World Health Organization, we have priorities that we focus on. And these priorities, there are 4 of them for WHO here in Namibia, which are guided by the international priorities of the World Health Organization. And these priorities are influenced by what we call the triple billion. So the first priority is looking at universal health coverage, so advancing universal health coverage. And what this means is that everybody, whoever you are, wherever you are living, and whatever situation that you have, whether you are rich or poor, you have access to care when you need it. And the expectation is that the goal for WHO is that 1 billion more people will have access to care by the 2023, when we come to the end of this strategy. The next priority is addressing health emergencies. So here again, we are looking at health emergencies such as the COVID, that people are protected. They are prevented health emergencies. We can identify them, and we can protect people from the health emergencies. And the third priority is promoting healthier populations, where we make sure that people are able to prevent, so people have the right foods so that they don't get malnourished. People are able to exercise so that they do not, they are able to maintain their health. People are able to stop practices that would lead to poor health. So those are the priorities, the main priorities. But as one of the critical things as part of our role is the way we work. And that's priority 4 speaks to that. So priority 4 speaks to the need for strengthening leadership, the leadership role of WHO in health, looking at the governance structures and also the enabling functions where we make sure that we are able to monitor health. Because whenever there's a crisis, and I'm sure as you have rightly seen with COVID, there has been a lot of reference to the World Health Organization because of the role that the World Health Organization has in health. So simply put, WHO's mission is to promote health, is to protect the vulnerable, and to keep the world healthy. So that is our vision as the World Health Organization. So looking at the role of the World Health Organization, I've talked a lot about health, and that is the role of the World Health Organization. So I would really like to link up, why is nutrition important? Why is nutrition critical to the work of the World Health Organization? It is because nutrition is an important part of health and development. And as the World Health Organization, we are into health. So when we consider nutrition, we realize that nutrition is critical across the life course. And right from even before you become pregnant, during your pregnancy, as a child, when the child is born, nutrition is critical. As a child, as an adolescent, and then when you become a mother, nutrition is critical across the life course. And we realize that nutrition is critical also for our immune system so that it prevents us from getting sick. The next thing that we also look at is that nutrition is also critical for development. And we know that health is very closely linked with development. If you consider some of the indicators in the country or in countries, if you look at education and if you look at educated mothers vis-a-vis the health of their children, you realize that educated mothers have better nourished children, are children who are healthier. So we see that health is very much related, interlinked with development. And for that reason, from WHO's perspective, we consider nutrition is important because it leads to better, healthier children who are able to learn better, and it also helps to break the cycle of poverty and hunger. And then thirdly, because malnutrition is a threat to human health. And once people are malnourished, they become sick, and we find them in our hospitals. And that is important to address. So WHO's nutrition mission is to ensure there's universal access. And when I talked about universal health coverage for all people, whoever you are, for all populations. So all populations have healthy, safe, and sustainable diets. So they have diets that keep them well nourished. And they also have effective interventions. So when I talk about effective interventions, it means that they are able to know exactly what should I eat. So they're able to go to the hospital, the health facility, and know that this is what I should eat. They should be able to know how to feed their babies. So they should be able to know how to put their babies to the breast so that they are well able to feed their babies. And then if they become sick from malnutrition, they should be able to have care in the hospital. But WHO's goal for nutrition is to end all forms of malnutrition. So our expectation is that we'll have children, mothers who are healthy enough to give birth to children who are healthy, who are well fed, and they would grow up to be very productive adults, and the cycle would continue. Because we do realize that the cycle, once the mother is malnourished, then the child also becomes malnourished. So that is WHO's goal, to be able to end all forms of malnutrition. So just a brief reflection on what is happening in terms of malnutrition. We see that there's a huge burden of malnutrition globally and in the African region particularly. So malnutrition in children contributes up to 45% of mortality amongst children. And we also see that there's increasing obesity rates are increasing, and this has implications on the health of the people. In Africa, there is quite a bit of nutrition transition, and before, the concerns in Africa were with malnutrition, undernutrition, where our children, and some of the typical pictures, you find our children are very skinny, or they have what we call kwashiorkor. But increasingly, we are seeing also obesity, where people are overnourished, and this also has implications for non-communicable diseases. And we call that the double burden of malnutrition. But recently, I also recognize that some are also talking about the triple burden of malnutrition on account of the micronutrient deficiencies. So we see that the malnutrition is quite high in our region. So WHO's response. So WHO, as the leading health agency, has a way it works. And one of the key things, the key areas that in which it responds, in terms of leadership, there's a lot of advocacy for health. But there's also what we call the norms and standards for health. So WHO produces a lot of guidance for countries. And these are what we call the norms and standards. And then there are also what we call World Health Assembly resolutions, where all countries come together, and WHO facilitates the discussion around some of the health issues to come up with some resolutions, some decisions that countries together can take to decide on the way forward for the health and well-being of the world. Okay, so these are some of this is not all, but these are some of the guidance documents that WHO has produced in the past 2 decades and even more, over 2 decades. And some of them, maybe I'll just mention 1 or 2 of them. For instance, the International Code of Marketing of Breast Milk Substitutes, that was a very key document, and there have been not revisions, but there have been updates to that document over the past years. And there are other documents that WHO produces, guidance documents that WHO produces. So just to look at some of these documents and what they are saying. So I'll just pick a couple of them. So the Comprehensive Plan on Infant and Young Child Nutrition. This is looking at maternal, infant, and young child nutrition and looking at some of the targets. So here I have just put out some of the targets and where Namibia is. I'm not going to go into too much detail. I think some of the presentations would do that. So we see these are the targets, and WHO sets these targets so that all countries can work towards the targets. So in Namibia, these are some of the things that are happening in Namibia in terms of the situation in the National Food and Security Policy, scaling up nutrition, and some other strategies. I would also just go over this and focus now briefly on the support to the country. So we saw at global level, the WHO sets various targets for the country, and it sets various guidance documents. When we come to country level, the Secretariat, that's the World Health Organization office within the country, now works with the country to see how they can support in implementing those guidance documents at national level. So for instance, in Namibia, at the policy level, there's some of the things we are working on is the regulations for marketing of breast milk substitutes. We also provide guidance, work with the country to look at how we can adapt the guidance at the country level. And then we also support capacity building and training in the various areas in nutrition. So having looked at that, just a few reflections on some of the areas that we still have work to do. So in implementing some of the plans that we have, in continued capacity, and it's a good thing that we have nutritionists who are being developed because you are going to be there in the facilities to strengthen the capacity. And also in monitoring the indicators, what is happening in Namibia. Most of our indicators we have from 2013, but now we are in 2021. So what is happening? what has happened over the years. And then we also need policies to make sure our people are protected. Our women can breastfeed when they need to. So, in conclusion, I would like to say that nutrition, we've looked at the fact that nutrition is critical for health, but not only for health, but generally for development. And it's critical in the context of the Sustainable Development Goals. I thank you, and I would take any questions. So if there are any questions, any reflections, I'm happy to take them. Thank you very much.
My name is Albertina Shikongo, and they call me Sister B. I educate people about food. I'm so happy for you, especially when you talk about nutrition in our country. It's something that is very, very ignored. And with me, I'm now 10 years in this business. It's what I do for a living. My aim is actually to educate people about food, teaching them how to prepare their food. So what makes me, I even want to cry. I've been trying with the Ministry of Health to tell them about the food that's available in our country, which is not known to my Namibian people. I'm taking from experience, there's a product that I sell, and I don't sell to Namibians. The reason is because the product is expensive, and you need to give a sample for a person to test. So when you give a sample, the person will refer another person, and I find out again in my country that people, we believe in medications. Medication is actually not a bad thing, but the body needs food, no matter what type of medication that you are taking. So I'm happy for you talking about nutrition. You really make my heart melting. And I really need to get you personally, because with me, I had a business which is called Tameka Nutrition Center. Tameka in my language means start. So with this business, I learned that in Namibia, it's not about body. You can be fat, you can be skinny, you want to gain weight. And when it comes to food, we eat the same food, whether we have different tribes. And again, in this business, in the center, I closed it down because it was very challenging in the way of seeing how people are suffering when it's come in terms of food. And the reason why I closed it down again, it was the students. When you look at our young people, they're under malnutrition. But when you do research going to Polytech and UNAM, you find out that kids are eating the same thing. They eat burgers. And with me, it came to realize me that I can't do these things on my own. And I tried. What I'm saying is, thank you very much for this. And I think this is what we need to start, because I'm opening now professionally, because I have somebody who studied nutrition. So we are opening up a nutrition center, I think, by end of this month. We are just busy facilitating it. The aim is actually to educate people about food and to teach people how to produce it and how to prepare it. And thank you very much for this platform.
Thank you very much for the question. I think this is more of a comment, and I appreciate the fact that, so you are actually affirming that nutrition is important. Thank you very much for that comment. Are there any other comments, any questions that anyone would like to ask?
Good morning to you all, and thank you, Dr. Mary, for that insightful presentation. My name is Jane Misarabu. I'm working at the School of Medicine, and we are doing quite a lot of research on food and nutrition and the effects on health with master's and PhD students. My question is, we have a limitation regarding research funding for most of the translational research that we do. So the question is, to what extent does WHO fund research? And if so, what are the dissemination strategies? Thank you.
Thank you very much for that question. So WHO is a technical agency. It's not a funding agency. Having said that, WHO is able to provide some funding minimally, but it will depend on the research and whether it's within the context of the work plan. Currently, the work plan for WHO for research, our focus is on strengthening the capacity of the country for research. Because what WHO believes is that each country should allocate some funding for research. So if we strengthen the structures for research, that would help in facilitating research at the country. But we can look at the research to see if we are able to help you to link up with other agencies, or even at global level. If there's a need for that research question at global level, there may be opportunities. So we don't typically fund, but then we are able to provide some support and guidance in research to strengthen the capacity. Maybe there may be funding, even locally, that will be able to help to mobilize. So I can say that we can have a discussion on that. Are there any other questions or comments, please?
Hello, my name is Lara Weisigel. I work for the German Development Corporation on agriculture and trade and ultimately food security. And I would be interested, as you were mentioning, food security, food and nutrition policies, what your evaluation of the current policies in Namibia are. I'm aware there were some reviews ongoing. I could imagine that WHO was involved in a consultative position. So your kind of spontaneous evaluation on that.
Yes, thank you for that. I did mention there is an overarching food and nutrition policy that has been developed over the past couple of years. And I think it's at a stage of being ratified, probably. But our thinking, because we did work with the government in developing that policy, and it wasn't just WHO. When I talked about partnerships, we also have the Food and Agriculture Organization. So WHO typically works in nutrition, and FAO works in food and agriculture and in terms of food security. So we do think we worked on that document together, and we believe that it is a very good document, a very comprehensive document. The challenge with policies is the implementation, and we really need to rally behind the government to support the implementation. So that is really my perspective on it, that it's a very good and comprehensive document, but we need to move the step further to make sure we have the institutional structures in place to be able to implement with the support from all of us partners working together. Thank you.
Hi. As I said, I work in development in rural areas. I look at your picture, the emotional picture you display here. And what I observe, most communities have the potential, the practical potential, to serve fresh veggies every day. They don't do it. Mm-hmm. You say the implementers, the policies, the governments. They are not the implementers. The implementers are the families. And I think that's where to start. So what is your stake on that one? Really going to grassroots, motivating people. We need somewhere a change of mindset, but we have a barrier. I don't know what it is, why people simply don't put seeds in the soil, give it a little bit of water. All resources are available. It would solve the problem. What is your stake on this, your comments on that one in the Namibian context?
Thank you very much. I think that is a very important issue that you have raised. And there again, the issue of partnerships. When I talk about nutrition, one of the ways in which WHO supports countries is to come up with guidance, nutrition guidance, what people should eat. And it's done very well in we have something we call the child health records. We look at the life course approach when people, and the health sector is able to engage people when they come for services. So within the health sector, what we do is to educate people on what to eat, so that people know that right from as a baby you need to breastfeed, but once you're a toddler you need to eat these foods. You don't really need sometimes the foods in the tins and in the shops, the fresh vegetables. However, we need to work also with the agriculture sector to make sure these vegetables are available, and these vegetables are in the community and they can be used, So it's a partnership, but within the health, that is what we do. We educate on what it's important to eat and trust that we can link up with the other sectors. But at this point, my time is up. I think I would like to thank you all, and I would like to thank NAFSAN very much for the opportunity. It has been very enlightening, and it's been a good opportunity to share these perspectives. Thank you very much, Ben.
Nutrition, 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 nutrition.